Hello and welcome back to Dialogue with Jenay. I am so excited because I have here I refer to her as the infamous, but the very wonderful, talented, and blessed Dr. Crystal Slade, who is an OBGYN, and she is very special to my family because out of 3 kids, she has delivered and birthed 2 of them. And she was a very integral part of number 2. So welcome, Dr. Slade.
Thank you. Glad to be here.
Yes. I know you've had a long day at work, and I greatly appreciate you stopping by to dialogue with me on women's health and how we can prevent certain diseases from occurring just by preventative medicine. And so we want to talk about ways to keep women and their unborn child safe from controllable toxins. So before we delve in, share a little bit about yourself with us, such as, how long you've been in practicing and what drew you to OBGYN.
Well, first, I've been in private practice for about 17 years. When I went into medical school, initially I thought that I was going to be a pediatrician. But when I did my rotation for obstetrics and gynecology, I really loved it and felt like this was better suited for me. So I chose obstetrics and gynecology. I really enjoy taking care of women. I love delivering babies, and I think that's such a special time in family's life, and I enjoy being a special part of that. But also I like taking care of women, educating women, motivating women, inspiring women. So this just seemed like the best fit for me. I also enjoy doing surgery as well, so I get to do all of that. So it's a combination of a lot of things.
Right. That's funny you mentioned pediatrician because back in my day, I thought I was going to be able to go to, I thought I wanted to be a pediatrician too. And because I love the kids, I love helping, serving and just, everybody love the kids, right? So that's funny you mentioned that, but you are definitely walking in your purpose. Just from my time, knowing you, I believe let's see, Jayla was born in 2007. That's my firstborn that Dr. Slade delivered, who was actually born premature. Can you talk to us, like, what are some of the risk factors that women are up against that kind of puts them at risk of having premature births?
Well, one thing is having a prior preterm birth will increase your risk for having preterm delivery for any subsequent delivery. Sometimes infection can be a risk factor for prematurity as well. If you've had multiple surgeries or procedures on your cervix, that can lead to preterm delivery as well. And there's a lot of times in terms of preterm delivery, we don't necessarily have a reason or why it happens. So some of it also can be unexplained as well.
Right. And that's funny you mentioned that because I know with me, they thought that I had an incompetent cervix, and so they thought that was it. However, when it came to my second child, they figured out that no, it wasn't that. It was the fact that I had an infection. And it's funny because we don't really know what risk we're at, and just by doing our standard of care. And so I remember the specialist was telling me, and I know you may be like, what? The specialist like, look, when you go see your OBGYN for your visits, if they don't have to check you, don't let them, because that puts you at risk of infection. What's your thoughts on that?
Well, I think that certainly if a woman is already dilated, then certainly that can be a risk in terms of infection, in terms of introducing infection, or definitely if you broke your water, multiple exams can increase your risk for infection. But also sometimes there can be ascending infections from the vagina as well. If there's any type of vaginitis, vaginal infections, then those can also cause infections that can lead to issues in terms of earlier preterm labor or preterm birth as well.
Right, right. Now, have you noticed, and within your tenure of practice, have you noticed a higher incidence between the different races as far as preterm births?
Well, it seems to be just from my observation that certainly African American women are at a higher risk and more likely in terms of preterm labor, preterm delivery, but certainly can happen among all races as well. So.
Right, right, right. Yeah, I remember when Jayla, my oldest, she was born at 27 weeks. And I remember I had to go into the hospital at 23 weeks because I was on bed rest at 18 weeks. And I remember talking to you and asking you, like, okay, well, are you going to be on call at Southern Region? And you were like, well, I'm only on call twice out of the month. And I'm like, wow, it's going to be hard to kind of time that.
Yeah, I was there.
You were there. So, and during that experience, they stated that with preemies, the hierarchy, I guess, as far as survival is African American females, followed by white females, followed by Black males, followed by white males. Now, does that still stand? Because of course that was back in 2007. Okay.
It does.
And is there a reason, like how they came about with that, or just based on how the curve went?
It's based on the numbers and what the outcomes and the experiences are.
Okay, okay. So, honey, when Jayla was born, I said, okay, she Black and she a female, so we good. We at the top of the list or whatnot. So we have just come off of October, which of course is breast, cancer awareness month. But just like with, cure and childhood cancer, I state that it should be 365 days out the month and not just set aside for that 1 month.
Agreed.
So with that, I do want to touch on some ways that we can help to better protect ourselves as women, when it comes to that. How have you seen the rise of the breast cancer cases throughout your tenure? Does it seem like it's getting higher, lower, or remaining the same?
I mean, I think the incidence of breast cancer has remained the same. I think that the mortality from breast cancer has actually decreased with earlier detection as well. And I think also awareness. So making people aware that, to make sure they do breast awareness exams and being aware of what's going on, I think helps people. If there's a problem or issue, then they're more likely to seek care the more that they know about it.
And with the environment and how the environmental toxins ranging from the foods we eat to the chemicals we're exposed to as far as cleaning, and chemicals we're exposed to as far as putting on our bodies, how, if at all, do you feel that has played a role with the increase in breast cancer cases?
I mean, definitely there are studies that show that different chemicals, toxins have been associated with breast cancer, any type of cancers in general. Also, certainly BPA that's been found in canned foods that used to be in a lot of plastics, even in baby bottles, has been associated with the increased risk of breast cancer. Some of the parabens that are in chemicals or cosmetics that we put on our skin, lotions, and things like that have also been associated with an increased risk of breast cancer as well. So I think that certainly the more we know, then the more we discourage those use. And I think now, certainly there's been a wave in terms of using natural products, cleaning products, as well as cosmetics, as well as lotions, even toothpaste and things like that. Now those things are being more commonplace now that we know the associations that are present.
Right, right. They're saying with knowledge comes power. And it's easy to say, but when you really think about that, like the more we know, then the more we're able to protect ourselves,
Right.
and protect our loved ones. And it's funny you mentioned, you know, about the products that we use on our skin, because when Jayla was born a preemie, I remember her neonatologist was telling us to be mindful of the products we use because it could affect her. And so, and I'm sitting there thinking, like, you know, and I like to add 1 + 1 = 2. But I'm like, so just by her touching our skin, it could cause her harm. So I'm like, well, what is it doing to my body? You know, with it being so thin, right? And so, and it was from that moment that I started researching, you know, the products, and the environmental working group. They became like my best friend. And like you mentioned, the toothpaste, honey, we got rid of everything. We got rid of the deodorants, the toothpaste, the lotions, everything. And I'm like, wow, you know, and I was just baffled, you know, here with us being in the United States, like how is this legal? You know, that they can actually put this on the market and sell it to us and act like everything is fine, but then wonder why, you know, cancer is increasing in not only women, you know, with breast cancer, men with prostate, but also childhood cancers, you know, on the rise, you know. And so I just didn't understand that. And so as women, we are the bearers of life, right? God placed that on us to carry and deliver and birth. You know, of course, we need man to help form the life. But explain to us or talk to us about how what we eat, what toxins we are exposed to, how that gets transferred to the uterus or to the baby inside of our uterus.
Well, I don't know, as it relates to breast cancer, a lot of what we eat and what we ingest is filtered through our system, and the baby really receives an ultrafiltrate of our blood. There are a lot of things that actually do not cross the placenta. In reading, as it relates specifically to breast cancer, there's really only one that I found, that the BPA, which like can be found in canned foods and also sometimes in certain plastics, was one of the things that potentially could be, if there's a higher level in BPA, that they also found a higher level in baby. And that was one association in terms of cancer risk for baby. But that was really the only one that I saw that was notable in terms of that. But also in utero exposure to DES, which was a high dose estrogen that used to be used in the past for prevention of preterm labor. Now that has been associated with breast cancer, but also it has been associated with certain other GYN cancers, or even cervical cancer in particular, in women as well.
Oh, wow. Now, is that still being used today?
No, it's not used anymore. So
okay, but the effects of it is still remains.
If you were exposed to it in utero.
Okay. Oh.
Mm-hmm.
So, I get it now. So, like if my mom was using that and I was exposed
Right.
to it,
Mm-hmm.
I would
Then
get
you
a
would
higher risk of
right.
developing breast cancer. Okay. I know the EWG did a story recently with, not a story, did a produced a research article that showed, I believe it was 10 babies, and it was African American babies or babies of color, and they tested their umbilical cord, the blood from the umbilical cord, and right straight after birth, it showed that they had higher incidences of lead, you know, straight out the womb, you know, with them being, you know, exposed to it. And of course, who are they getting it from? You know, being transferred. Exactly. And so they were stating that research prior showed that the placenta kind of eliminated certain toxins, you know, from them, but it's showing that all of, like you were saying, all of the toxins are not being filtered, and it's going through to the baby. And so I remember when we were at a cancer killers conference, you know, through the fight with Jayla, a doctor there exposed the fact that a baby doesn't have to be preemie or just a regular term baby. When they're born with over 200 to 300 toxins in their blood. And it's like, wow. And I remember, with Jayla, with her being born premature, I know she was exposed to a lot because I was on bed rest. And so I was taking all the medicines to try to keep her in as long as I could. And then, of course, I got the infection, which exacerbated her delivery. But then even with her being in the NICU, all the medicines and stuff they have to give her, to help keep her here. So it's almost like we can't get a break. We expose them to a lot to try to get them here. Then we expose them to even more to try to keep them here, because unfortunately, which was kind of baffling, when a baby is born premature and they end up in the NICU, they really don't know what's going to happen. They say basically we do our part, the baby does its part, and then God handles the rest. And you sitting there like, really? That's what you're telling me? Like, we really don't know what's gonna happen day to day. Like, it ain't guaranteed that I'm walking out of here with my child, and that becomes real, And so it's very good to have doctors such as yourself to help women live their best life in preparation of preparing for a family, and especially down that road of now you have baby inside of you, how to live healthy, how to eat healthy, and all of those things. And I know that personally, you have been a very integral part of our life, my family's life, especially during that fight with Jayla. And you introduced some essential oils, to us in helping to fight her pediatric brain tumor. Can you speak more on that, either from a personal perspective or just information you've learned, how essential oils can be a very integral part as far as preventative things and actually addressing certain issues?
Well, I can't say that there's a whole lot of medical data that can be applied or that's necessarily FDA approved in terms of all of the essential oils. But certainly, I think that there's certainly some benefits, and they have some places in addition to traditional or modern medicine as well. I think that certainly there are many things that are placed on this earth, plants, foods that you get nutrition from, that can be helpful for various things. Like I said, I can't say that I have a whole lot of medical data or FDA approved studies, but I like them. I find them helpful, and I think that they're an alternative that many people use and find helpful as well.
Right. Yes, and that's it's kind of okay. So let's take it with a grain of salt as far as Dr. Slade said, not FDA approved, right? Because I'm going back to that with our products that we use on our skin.
Right, that some are FDA approved.
Exactly. And
it's ironic, yeah.
Right. So we definitely have to be proactive, in taking care of ourselves. And you definitely want to make sure that whoever you have partner with, as far as your family's health, as far as your personal health, you want to make sure that they are well versed in not only the Western medicine, but also other ways to help keep you and your family safe. And that's one reason I wanted to interview Dr. Slade, because I feel that she is definitely a jewel. So if you are looking for an OBGYN, she is located in Metro South Atlanta. I think you have a few different locations. Can you share that with us?
So we have an office in Stockbridge as well as Fayetteville and Newnan, but I'm primarily in the Stockbridge and the Fayetteville offices.
Yes. And then what's the name of your practice?
Southern Crescent Women's Healthcare.
Yes. So you definitely want to make sure you look that up because she gets rave reviews, you understand? And it is funny because, again, like I said, I had 3
Have
kids.
you been checking my reviews?
Honey, well, look, I know I need the real life in-person reviews. You know, the moment I picture you on Facebook, everybody, I'm like, Dr. Slay, oh, yeah. Yes. But when you have a light such as yours that shines as bright as it does, you know, I ain't let it get. But you know, I mean, people see you're walking in your purpose, and you know, it's hard because you have a family of your own, and especially now with this COVID, you know, you're on the front line, and so
Yes.
you battle. I'm sure every day, you know, do I look out for my family? Do I look out for my patients? You know, like you have a calling. And at the same time, you want to be there for your patients and you want to be there for your family as well. Can you share with us? Because as women, we juggle a lot. And part of taking care of ourselves is self-care, mental health. You know, a lot of people, especially in the Black community, you know, we don't talk much about mental health. And so can you share with us how you are able to balance, you know, the work-life balance, or, you know, is that something that you struggle with also?
I mean, certainly, I think it's a challenge for everybody, but certainly I have a very supportive spouse, which helps me with the kids. So it helps it to be more manageable when I'm on call. If I'm at the hospital and I know that my kids are well taken care of, my husband is very involved and very supportive. So that helps in terms of that. I try to exercise as much as possible. I don't always get to it as much as I would like to, but I like to exercise in the morning and have my, what I call my time of reflection. So I'm on my treadmill. Sometimes it's hard for me to read and run at the same time. But sometimes I listen to messages, to sermons, different podcasts, and just kind of just take time for myself. So my morning time usually is my me time. And then certainly when I'm at work, I like to focus on work and be at work and do what I need to do at work. But then when I leave at 5 o'clock, not always 5 o'clock, sometimes 6 o'clock, when I'm at home, then I try to disconnect and be present at home and be involved with my children during that time. So, and there are some days that I do better at it and some days that I don't. So, and then some days that I'm completely exhausted. And some days that I feel like I work too long and too much, but then there's some days where I decide that I'm checking out and I'm just being at home. So it's a balance, and not every day looks the same. And I think that sometimes one day I may focus on one task and then the other day I may focus on the other task. So it's like a juggle. So one day this is in the air, but I'm doing that. And the other day this is in the air and I'm doing that. So it kind of works. It just works. So, and after you do it for a long time, you just kind of figure it out.
Right. It becomes like second nature, and you know what works and what doesn't. What are some strategies that you can think of that can help women, you know, keep their sanity, I guess, especially during this time, you know, where there's some may be managing, you know, working from home, virtual schooling with the kids, you know, as well as, you know, managing that with the spouse also, you know, working from home as well. What are some strategies you can give that can help women put their mental health and emotional health first?
I think that you have to take time for just me time and time for self-care and self-reflection, even if that means just getting out and taking a 30-minute walk, whether it's either with your family or by yourself, just to kind of disconnect and get some fresh air. I think that's important, but also exercising as well.
Yeah.
So I know for a lot of people, virtual school, homeschool has been a challenge. I know some people do that all the time and do it well. Not me, but I have a newfound respect for the teachers and the people that homeschool. My hat is off to you all. Yeah.
Right. Yeah, look, that's funny you mentioned that because of course, we've been homeschooling since day one, it'll be 13 years coming up in December. But, and it was funny. So when COVID first hit, and I'm like, oh, okay, this will be good, and then, you hear people stressing out, and all this and that. I'm like, but why they stressing out? Like what's going on, and all this and that. But then it hit me. I had to go all the way back to the beginning because in the beginning, I was stressing out. I was like, how am I supposed to stay in these four walls and teach these kids and not get a break? I gotta be mommy, I gotta be teacher, I gotta be chef, I gotta be wife, you gotta be it all, right? And you don't get a break. And it's like, wow. And it's funny how, like you say, when you've done something a while, for a long time, you figure out how to work and it just goes to autopilot, right? So that was us. And I was like, wow, that was fun. And it's fun. It's almost like having kids, when you had that first one, you're like, well, how am I supposed to, cook and watch the baby? How am I supposed to do the dishes and watch the baby? How am I supposed to do this? Then the second would come and you're like, oh, okay. Oh, it wasn't that bad with the first one, but now I'm supposed to do this with two, right? And then look, when the third one comes, you're like, okay, I'm a pro. You're like, you sure it's so. So it's like we tend to rise to the occasion, and as women, that's what we do. That's what we've always done through history. Our ancestors, no matter what the challenge was, we made it head on, and and we conquered it. Some of us we conquered it. Some of us, we do the best we can and try, maintain and get through. But we have that support system, with women together, helping each other, and so that's good. To be able to have that. So you definitely, like Dr. Slade said, you definitely want to make sure that you take time for yourself. Take time to exercise, and even if you have to incorporate it, with your family, do that. Because I know in August I was doing a 100 miles in August challenge, and honey, me and them kids were hitting that pavement every day. They were on their bikes, and I was walking, clocking my miles, and it was so funny. When it got to the end, I did the end by myself, and my son was like, when I came back, I was like, I did it, and he was like, you did what? And I was like, I did 100 pounds. He's like, you did it without me? Like, you finished without me? And let's go back. But it's funny how even, we set the examples. By taking care of ourselves, we show our children and our family what's important. And self-care is definitely important. What are some other preventative methods regarding breast cancer? I know back in the day, it was some talk about underwire bras. Is that still an issue or concern, or?
I mean, it really hasn't been proven to be associated with an increase of breast cancer. The concern was if there was a significant amount of compression, if that prevented drainage from the lymphatic system. But really, there haven't been any studies to show that there's been a direct association with that. So it's not necessarily a direct link or cause in terms of that.
Okay. And then what about like breast augmentations or reductions or anything, does that increase your risk, or is that like null and void?
Not necessarily. As it relates to silicone, I know there was a lot of issues in terms of whether it was leakage or not, but really it doesn't increase the presence of augmentation. Reduction doesn't increase it, but also sometimes it will limit visualization during some mammograms. So they have to do additional views or kind of do it a certain way in order to really be able to see. So sometimes it may limit visualization, but it doesn't necessarily increase or cause it per se.
Okay. And I know you mentioned mammograms before, and you and I have had, conversations about thermography. Has anything changed, since, well, first, again, on our Cancer Killers journey, we went to a conference and they mentioned that by the time the breast cancer or shows up on the mammogram, that it's been there for years, right? But with thermography, you're able to see it sooner, perhaps. Is there any talk about, thermography being a part of the diagnostic screening for early detection?
Well, I mean, certainly there are many modalities in terms of looking and assessing. Currently, the mammogram is considered to be the gold standard. I know there's concern, different people in terms of having mammograms just for their radiation exposure. So certainly now, it used to be, initially it was recommended that everybody at the age of 40 have a mammogram on a yearly basis who are average risk. Certainly people who are higher risk, more frequent screening. But now, certainly we know that the more screening that we do, sometimes there are false positives, that we find things that that are biopsied that are completely benign, and certainly that for some women that puts more stress. So now it's geared more towards shared decision making between the provider and the patient. So now some task force advocate between the ages of 40 and 50 doing people who are average risk or low risk doing a mammogram every other year as opposed to yearly. Certainly if you're at high risk, you would do it sooner as well. And there are people who have reservations, like with mammography in general. Then it goes back to the shared decision making in terms of how high risk are you, how much would this prevent or decrease your mortality if something really is present. So I think that for people who have grave reservations, then you really have to do shared decision making with your provider in terms of the frequency, if you're really concerned about the radiation exposure.
Mm-hmm.
Now, also there are women who are at a higher risk for breast cancer. Sometimes you can do genetic screening to see if you carry any gene mutations that may increase your risk as well. And if there are any additional studies needed or additional screening needed based on that, then that will be individualized too, just based on your family history or if there's any genetic mutations that are present. So.
Okay. And
so things are a little bit more individualized. I would say
good,
that.
good. And do you think how has that come across with your patients? Do they seem to like that more, or do they seem to prefer, like, well, no, I need you to tell me what to do?
I think it's patient dependent. I think people who have a family history of breast cancer want to do the screening because of early detection. So that's a potential to decrease the mortality if you're at a higher risk, if you've had a family member, if you've had a close friend. I think for some people it offers reassurance to do screening to know if there is a problem or an issue. But then also there are patients who, like, that have reservations about having the mammogram. It is not comfortable, it is painful. There is radiation exposure. I mean, but usually in terms of the amount of radiation and the incidence or frequency of cancers from the radiation is really small in terms of that. But like I said, different people have different preferences in terms of their concerns. So if somebody is really not wanting to have it, like I said, you really have to weigh their risk, and it's more informed decision making at that point, discussing what their individual risks are potentially for breast cancer, what their family history is, and what the risk of the test may be.
Yeah, I think I know, well, you already know, you you already know how we roll over here, but yes,
so,
right. I do like the shared
decision making.
I do like that, because we definitely, we as everybody, we need to recognize the power that we have. And like doctors, you all are gifted, and you all have been tasked with a very important, for lack of a better word, and an important gift. But it's just that you are human, and as humans, we all make mistakes. And so we have to empower ourselves. And so, and that's why, you know, it's funny because until you actually go through something, be it breast cancer, be it childhood cancer, be it I don't know, any type of disease, you know, that changes your life, you know, a parent diagnosed with a dementia or Alzheimer's, anything that changes your day-to-day life. Until you go through something like that, you never get to understand totally the relationship between physician and patient. And I remember when we went through our fight with Jayla, when she was diagnosed with pediatric brain tumor, brain cancer, and the doctor, her pediatric oncologist, was very adamant about chemo and radiation. And so, of course, we sought out second opinions and all of that. And by the time we got back to him, we were like, okay, we want to try, you know, this chemo part over here, perhaps chemo part over here. And he was saying no, because they had just found out the day before, because the big wigs had a meeting and research was showing that that one and only chemo drug that they were recommending is now causing harm to the patient. And I was just baffled because he was so adamant. Like, up until that one day, all the days prior to that, he was very adamant. Chemo, radiation, you gotta do this, you gotta do this. And in less than 24 hours, he was like, no, I'm not doing it. I'm not giving your child chemo. I said, so y'all are truly practicing medicine. You know, it's like, that just opened my eyes right then, because you only, and it's just like anything in life, you only know what you know until something else comes along to show you that what you know is not working. You're gonna keep doing that. And it's like, okay, so that shared decision making is very important, because it puts some responsibility on us as patients. That we have to know what we're dealing with, we have to know what we're up against, and we have to look at the relationship with the provider you have chosen, that you all are partners, and together you can solve whatever problem it is that you're up against. And Dr. Slade, you know, because of what we went through with Jayla, and then with my second being born with multiple food allergies, you know, and severe eczema, environmental allergies, and all of that, and because of what I went through being on bed rest, by the time my third child came, I told Dr. Slade, because my second child, I ended up having, it was a VBAC, because Jayla, my first child, Dr. Slade delivered at 27 weeks, was vaginal, no, was C-section. And so when Dale came, I did no drugs whatsoever, and did a VBAC, all natural. And so when the third one came, I told Dr. Slade, I said, I don't know if we can do this, but we need to go back, way back to when we had the Garden of Eden, you know. And I said, I need no intervention whatsoever. And that was because of my, almost like my mental and emotional health, because of what I went through with my child being diagnosed with a pediatric brain tumor just out of the blue. And it's like, I could not deal with, because cancer, you know, it does not run in our family. And so clearly she had to get it from environmental, or somehow it was introduced to her body. And so I was at the mindset of, I can handle anything as long as I know God is in control. But if I know man has something to do with it, whoever is from Brady, y'all know about that 7th floor. I said, you just go ahead and take me down. I said, and Dr. Slade, she was kind enough and gentle enough and intelligent and smart to allow me to do that, but within guidance, because again, we had a partner relationship. And so definitely, if you have not found, you know, if you're still of the childbearing age, And even if if you're with child now and you don't like your doctor, definitely look up Dr. Crystal Slade, because she is definitely of God, for God, and by God. She is definitely walking in her purpose. And it's not that often that you can find a physician that will take care of you as though they're taking care of their family. And
thank you, Janae.
You are more than welcome. Yes, yes, yes. You are
Yeah.
more than welcome. You are more than welcome. And so, as we close up, because you are a wealth of knowledge, and we can go on for days and days, but clearly we'll come back together and do more of these dialogues, because you are walking in your purpose. Helping women is your purpose. Bringing life into this world is your purpose. And fixing things is your purpose through the surgery, and so definitely we will be coming back, to be able to share more information with you all, with Dr. Slade. But before we go, is it anything you can share with women, especially at this particular time, things to what helps to keep you motivated, what helps to keep you pushing on when sometimes you may feel like, okay, I've had enough?
Certainly knowing that I am helping others, that I am helping women, motivates me, but also for my kids and for my family as well, especially being an example for my daughter who wants to be a doctor. She believes, and I think that she will, just setting an example for her as well, though. But knowing that I have purpose and that I do help people is also rewarding for me. That motivates me. Sometimes I don't always get thank yous. We don't always get praises, but when I do, when I have special relationships, when I have special bonds with patients, that helps me, and that's motivating as well. Just like my bond with Janae. So,
Yes, 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 yes.
So yeah, so you always have those special patients that then become friends as well. So
good, good. So ladies and gentlemen, if you haven't grabbed that one thing, the one thing that I do want you to take away from this is look within yourself and see what your purpose is. If you don't know what it is, just talk to your friends and say, what do you see in me that you feel is my gift? Because sometimes we need help in finding that, but we all have a special light within us, and we all have a gift to share with others. And so it is my hope that through my different dialogues that I am inspiring you to your purpose. And so I thank Dr. Slade for joining us. I thank you all for tuning in. And again, Dr. Slade can be found in Fayetteville and Stockbridge at Southern Crescent Women's Health. So definitely look her up. If you need direct the number, to that location, just DM me, text me, and I can give it to you, because she is definitely one you do want to have, either helping you to bring life in or helping you continuing your woman's healthcare needs. So until next time, yes, you're welcome. Yes, keep the dialogue going, and we'll see you all later. Thanks.
Well,